I'm really excited today. Today is Outright Vermont Youth Leadership Day at the State House, and we are joined by lots of youth leaders. And going to get to know everyone here for a little bit. And so why don't we start, since we have a lot of people in the room, we'll start by going around the room, each of us individually, so we can introduce ourselves to you, and then you can briefly introduce yourself to us. Maybe give us your name and where you're from. That would be great. And then we have a couple of people who are speaking. So this is really exciting. So let's start with Lori.
Great. Hi, everyone. Thanks for being here. It's exciting to see so many people. I'm Lori Houghton, and I serve Essex Junction.
Yes, and Leslie Goldman, I'm from Wyndham County, down near Bellows Falls.
Laurie Curtis, I live in Bristol, and my pronouns are she, they.
Debbie Powers, I'm from Waterford and represent Barnett and Redgate also.
Kristen, you want to introduce yourself?
Yeah, I'm Kristen and I'm the committee assistant. From where?
Oh,
I live in Burlington.
I'm Topper McFawn, and I represent Barrytown and part of Williamstown. And it's nice to see you all here today.
And I am Alyssa Black, and I represent sort of the northern part of Essex.
Hi, I'm Daisy Rebecca. My pronouns are she, her, and I represent Winooski, and I'm so happy to see you all here with us today.
And I'm Wendy Critchlow and I represent Colchester, and I'm also glad to see everybody here today.
And I'm Woodman Page and I'm from Newport.
Alan DeMar, I represent Enosburg and Montgomery. Nice to meet you.
So why don't we start around the room? I said I was going to start with Jessica, but you can be second.
Wonderful. I'm Amanda Rodenberg. I use she, her pronouns. I'm the associate director at Outright Vermont.
Jessica Oski with McCracken Group. I'm a volunteer with Outright Vermont.
Jessica Barquist, I use she, her pronouns, and I'm with Planned Parenthood.
Elliot.
I'm Megan Kelly. I'm one of the GSA advisors at Cheltenham Community School. I also teach Spanish there, and Elliot's one of my students, so from Cheltenham.
Brian Wiggins, parent of some of one of these kids.
Ginger Irish, she, her pronouns. I'm the director of development at Outright.
We know Ginger. And
Yeah, we do.
That's right.
Alex, he, they pronouns. I'm coming from Plainfield and I'm a youth organizer with Outright.
I'm at she, her pronouns. I'm from Fairfax, and I'm a youth organizer as well. I'm Belle, I use all pronouns.
Use he, they pronouns and I'm Clementine, I'm 11, I use she, they pronouns. I'm from Shelton. So.
Annette, I use she, her, and I'm one of the co-advisors with Megan at Cheltenham Community School.
I use she, her pronouns. I'm from Eastburg and I'm here with Umbrella.
Hi, I'm Griffin. I use he, him pronouns. I'm from South Bureau in South Burlington. I am an Outright youth organizer.
Hi, I'm Fiona. I use I and all pronouns and I'm from Otter Valley, GSA. I'm Eli. I use he, him pronouns and I'm a student at Shelburne Community School.
welcome, everyone. Excited to have you. So Alex, I think you're do you want to sit up here in the front of the room?
Sure.
So right there.
Don't panic. You can
That's right. You can stay right there.
Here, switch seats.
Oh, that's so fancy.
There's a button on the side of the seat. It'll cool it down for you.
This is only. Witness check.
Do you want anyone to take a picture of you to send to you only?
People can take pictures if they would like picture. I don't mind.
Okay, and maybe I can send it to Ginger to send to you or something like that.
Okay,
Yeah.
thank you.
That's a great idea, Mari, because, and Mari, if you'll take the lead on taking pictures.
Sure.
You're usually snapping pictures anyways.
Yes,
but
I'd love to take pictures.
yes.
All good?
All good.
Okay. Just to introduce myself again, I'm Alex Yam Halberg. My pronouns are he, they. I'm a senior in high school, and this is my second year as a youth organizer with Outright. I want to focus the 3 minutes that I get to speak with you on gender affirming care, what you all plan to do to protect trans individuals in healthcare, and what we can do to help you help us. When reflecting on the state of our country right now, specifically as it relates to transgender youth, I notice more and more the abundance of misinformation, disinformation, and the harmful rhetoric directed specifically at children, villainizing us and our experiences instead of attempting to understand. This rhetoric is encouraged by a combination of intentionally destructive and ignorant political officials. It is our responsibility as LGBTQ+ youth to communicate our needs and what you can do for us. And it's your responsibility to listen. Thank you for listening. A phrase that is frequently uttered when discussing gender-affirming care and resources is that gender-affirming care saves lives. This may sound dramatic or over-exaggerated, but it isn't. As I've grown and discovered my own identity, I've watched many others come to terms with theirs. I've watched the negative effects of transphobic rhetoric and supported peers as invalidation push them to the point of hurting themselves. I felt the discomfort of gender dysphoria, the pain when someone you love misgenders you for the 1,000th time. As individuals, I believe our top priority should be living our best lives as our most unapologetic selves. But how can one do that when they feel uncomfortable in their own body, when their identity is constantly being invalidated by their government? As we are constantly facing invalidation from the federal government, we need your protection and your voice. I ask that the committee work to protect gender-affirming care, specifically for youth in Vermont, and that you use your voice and your position to normalize our identities.
Thank you. Are our witnesses willing to take questions? Because,
yeah.
And so I'm just going to ask the committee, we may not have any questions, but if anyone has any questions for.
I do.
You do, okay.
Could you tell us what you mean by the very end of your presentation?
By when I said
Validation part.
invalidation and validation. I feel like a lot of the time sort of the impression that is coming from our society in general is that our trans identities are sort of silly or ridiculous, or that we're delusional or not thinking fully, or that we're being sort of taught these ideas instead of that it's part of our identity. And I think that that's a really big proponent in sort of the destructive ideology towards trans individuals that's so present right now. I think that if people were able to just understand that it's as simple as just like you feel more comfortable with a certain hair color, or you feel like it's just about how you can be yourself and how you can express yourself. And I think that if that is more sort of widely spoken about, that it's just as simple as that, people will understand more that it isn't destructive. It's a positive sort of thing.
Thank you very much.
Thank you.
Well done.
All right.
Thanks so much.
Next, we have Emmett.
Does anyone not want their picture taken?
At Outright, we have a sign. If somebody's taking their photo, you can always put your hand in front of your face when you don't use that photo.
Yeah.
And again,
These photos will not be used in any way other than to send to you if you want a photo of yourself.
But Emmett, you did this.
Sorry, I was showing an example. I was a little photo video.
That's recording it.
Yeah. Okay, good morning. My name is Emmett Wiggins and I use he, him pronouns. I'm a senior in high school and I've lived in Vermont my whole life. I testify before you today to advocate for transgender youth and their freedom to feel happy and safe in their bodies. Gender-affirming healthcare has been under fire across the country, including here in Vermont. In having these essential services called into question, transgender folks across the state have had to grapple with the possibility of losing the care they depend on. No one should have to hold such a fear. When I was 16, I came out to my family as transgender and was met with an unending amount of love and support. With that support, I've had the opportunity to pursue various forms of gender-affirming care, simple things like a haircut and new clothes, and more challenging steps such as legally changing my name. I can confidently say gender-affirming care has greatly improved and ultimately saved my life. I have yet to pursue medical transition as I made the personal choice to wait until I turned 18. But I now turn 18 in 1 week. After a long wait, I am concerned I may not have the ability to get the healthcare I need if action is not taken to protect access to it. Vermont is considered a safe state for transgender individuals, and I do believe that to be true. However, I know that unless we continue to work towards a bigger, better future, we run the risk of going back to a time where I would not be safe being openly transgender in my community and would not have access to the care that saved my life, a reality that too many kids face today. I urge the committee to work to keep gender-affirming healthcare accessible and to consider transgender folks of all ages, especially youth, when making decisions that will drastically impact us. Thank you for your time today.
Thank you.
Thank you, Emmett.
Proud dad.
Biggest fan. What do you, yeah, what do you have a question?
Mark,
Mhm.
can you get the surgery or the care that you need, or do you have to go out of state?
It depends, but from what I understand, there is a lot of opportunities in Vermont to get the care you need. Some surgeons specifically may be out of state due to like specialized care. But access do you have?
Yeah, it's often difficult to get it covered under insurance.
That
a lot
is.
of the time, specifically for people under 19, because they're actively trying to change it to 19 from 18 federally. So there's a lot of limits on whether you're on Vermont healthcare and needing to go somewhere else to get it, or whether it's in Vermont and you are able to not. There's a lot more challenges.
Mhm. Yeah, affordability is just the biggest barrier, I would say.
Thank you, Emmett.
Thank you.
Thank you.
Happy early birthday.
Yeah. Next, we have Griffin. Welcome, Griffin.
Hi, I'm Griffin Carrier. I use he, him pronouns. I am a senior at South Burlington High School. I testify here before you today to advocate for suicide prevention and mental health resources in educational institutions throughout the state of Vermont. Suicide and mental health are global issues. Studies show that most people who die by suicide have suffered from a mental health disorder, but people with mental disorders do not die by suicide as a result of their own actions. According to Major David Reynolds, Chief of Clinical Health Psychology at Landshall Regional Medical Center, the vast majority of people don't commit suicide because they want to kill themselves, but as a way to end the torment of not being able to cope with their problem. Suicide prevention and mental health resources in Vermont are severely lacking. Although the Vermont Department of Mental Health released the strategic plan for suicide prevention in July of 2024, access to these critical resources in schools remains insufficient. It's not helpful when a student goes to a teacher or administrator in their school asking for help, and the teacher or administrator dismisses their request and says something like, "I'm sorry, I wish there was something I could do to help, but you can reach out to said third-party organization." I have heard this a lot at my school, and other students across the state have heard it too. Many educational institutions, especially high schools, have excuses that they can't help students, but they can. When they can't, that builds upon these problems. Yes, it will cost money and investments, but the thing is that that's worth fighting for. And sometimes it doesn't cost a thing. Educational institutions need in-school resources for suicide prevention and mental health. With that alone, you can help save a student's life while improving their mental health. The key is kindness, and the wonderful thing about kindness is it doesn't cost a thing. Thank you.
Thank you.
Yeah.
Thank you, Griffin.
You're right.
Hmm?
You're right.
You're right. It was this committee that created that statewide plan, and one of the things that we know that we're lacking, and we talk about it all the time, is a strategic statewide plan for schools. So thank you for reminding us of that. Okay, and yeah, go ahead.
Quick question. Can you share one thing that maybe worked for you or friends that you could do when things are hard, that maybe doesn't cost anything, it's just kind of organic, that you can do to help each other out?
Just take time to yourself, even though if someone is like, it's not a great time. If you know yourself, when you know yourself and you know that you need to take space away to cool down to help to better your mental health and well-being, then you should do that, regardless of what anybody else says.
Can we go off of live, please?